Dr. Charles Bird dedicated his life to finding better ways to diagnose and treat breast and prostate cancers. As a frontline endocrinologist, he also helped many patients manage conditions such as diabetes. Now, he's seeding a future of research discoveries as he has planned a future donation of his registered retirement investment fund in support of local patient-oriented research through the University Hospital's Kingston Foundation. We're pleased to share his story. Dr. Bird worked closely with Dr. Albert Clark from the Department of Biochemistry at Queen's.
We were interested in hormones and cancer, so we were studying men with prostate cancer and women with breast cancer. And this for us was a very exciting time, and we made a lot of, we think, reasonable progress in our research. We weren't groundbreakers or anything, but we did do a lot of work and had a great group of people working with us. And I think that Dr. Clark's and my relationship of a basic scientist and a clinical scientist was early on in the career in the medical schools in Canada. I'm sure there were other pair, but not many, that worked as well as Albert and I did. At that time in the Angata wing, there was a unit called the Special Investigation Unit, and there was a nurse there by the name of Barbara Push who ran the unit, and we investigated all our patients, and we had both men and women studying their hormone metabolism there. And Barbara was an absolutely superb nurse and made sure that when we wanted things done, they were done exactly the way we wanted them. So we generated a lot of data from true patients with breast cancer and prostate cancer, as well as a number of patients who were controls. So it was very interesting, and it took a lot of organization, and the hospital couldn't have been more cooperative. They gave us the space when we wanted it. They supported our research. The Department of Medicine, in which I was a member, and the Department of Biochemistry for Dr. Clark were very supportive in what we were trying to do. We enjoyed every minute of it.
Dr. Bird is making a deferred gift to UHKF in support of research at Kingston General Hospital. He's making a similar gift to Queen's Faculty of Health Sciences.
I always have believed that fundamental research is the key to making progress in medicine. And people much smarter than I have said the same thing, that you don't make progress, you stand still if you don't have new ideas and new approaches coming in all the time. So I'm committed to research.
Zoë MacKenzie is responsible for meeting with people who are interested in learning more about how they can make a planned gift in support of equipment, care, research, education, or capital developments in Kingston's hospitals.
My role is to make sure that that gift is used in exactly the way that the donor would like it to be used, and for the needs of the hospitals, whether it be one or all three of our hospitals. But it's a very exciting time for everybody.
There are many ways an individual can make a planned gift. The kind that Dr. Bird has made is a future gift of a RRIF, or Registered Retirement Investment Fund.
Many people know that saving for retirement is an important part of a financial plan, but few people have a strategy to consider what happens to their RIF or their RRSPs when they pass away. I would advise to talk to your financial advisor to get information on how it can make a difference with their estate taxes. I'm not qualified to provide financial advice, but I highly recommend individuals consider taxing implications of their RIFs or RRSPs, because retirement plan assets are one of the most heavily taxed estate assets to pass to heirs. Now that Canadians can receive tax credits for charitable gifts up to 100% of their income, it may make good sense to gift their assets directly to the charity.
Setting up a deferred gift of an RRSP or RRIF is as simple as changing the name of the beneficiary. And because gifts of RRSPs and RRIFs fall outside your estate, they are not subject to probate.
Many people are unaware that charitable donations of a registered retirement plan can significantly reduce taxes for the estate, providing greater assets for your beneficiaries. These types of gifts also provide peace of mind and letting you use the retirement savings investment while you're still alive.
Planned gifts to the University Hospital's Kingston Foundation may be designated to a particular hospital, specified program, or it could be shared by all 3 hospitals. Future gifts of registered retirement investment funds, like that made by Dr. Bird, can help ensure the residents of southeastern Ontario continue to have access to the best healthcare possible.
We are so fortunate. My boss, my mentor, Larry Wilson, used to say that if a man from the moon came down to Canada to look at the medical schools, one of the questions he would ask is, why is there one in Kingston, which is so small? And the people in Kingston, I don't think, really appreciate the quality of the people that are there, because so many of them are really extremely well trained and very talented in their field. Because in my opinion, Kingston's a great place to live and raise a family, and yet still get the academic benefit of the university, which is, to me, one of the reasons I decided to go in that direction.